We'll get started here. I want to thank everybody for joining us this morning for a webinar that will talk about Excellus Medicare plans. Medicare Advantage is being one of the premier carriers, providing a lot of value throughout Western New York region. Specifically for this presentation, we'll be discussing uh, those plans that are in the greater Rochester market. And I'm glad to have with us today Darcie Coleman, account sales uh, manager with Excellus, and she will be glad to make the presentation. And then after the presentation, please feel free to ask any questions. Type in your questions that you see there into the chat feature there into the Zoom chat function, and we'll be sure to address any questions at the conclusion or throughout the presentation if warranted. With that, I again thank everybody for joining us. I want to turn it over to Darcie. So Darcie, thank you very much.
Thanks, Rob. I appreciate it. So good afternoon, or really good morning, everyone. My name is Darcie Coleman. As Rob said, I am the broker account executive for Western New York as well as the Rochester region. Today, I'm actually going to just touch base a little bit on the East as well. Some of you may sell out in CNY as well as Rochester. I'm hoping this may be a refresher for some of you, and for some of you, this may be, new information. So the goal really is ultimately to make sure that, you feel like you're taking something away from this. So with that, I'm going to get started. So really, who are we? So who is Excellus Blue Cross Blue Shield? We are in 31 counties of upstate New York. We have nearly 90 years serving our communities and members in upstate New York. So, what does that really mean for our members? Really, what it means is that we've built a really strong rapport with our providers as well as hospitals over the course of 90 years. Excellus contracts with 98% of local doctors and hospitals. So this really ensures that our members have access to a really robust provider network. And that's really vital to, their health and well-being. Our family of companies, we employ about 5,000 of your friends and neighbors. So again, the localism piece, we really, really hang our hats on that. When you're reaching out to customer care, it could be your neighbor, it could be somebody, that is basically in your region. We do have a broker support team as well that is also local. So it's really nice that when you need an answer or you have questions, you're not calling out of state, you're not being put on hold. There's somebody locally that is going to pick up or respond to your email or your phone call and certainly try and help you. Currently, we serve over 1.5 million members. And we also partner with local organizations and charities, and we really try to give back to our communities. Ultimately, we're really dedicated to helping our seniors live healthier lives. So this is just a quick snapshot of the PPO network and it's considered Blue Card. So this would be for the Excellus region. Our Blue Card network includes 2,500 counties, 48 states, and 2 territories, which are Puerto Rico and the Virgin Islands. What I generally tell people, the easiest way, if you have a member that's going to be traveling, you have a snowbird that's going to be, say, in Florida, in my opinion, the easiest thing to do is call that provider's office, ask to speak to the billing department, and all you really need to say is, do you participate with Blue Cross Blue Shield, the Blue Card network? If they do, then you know that those claims, when they hit our system, they're going to process as in network. But a really robust PPO network access. And that would be for our Discovery plan in Rochester, which I'll talk about in a moment. So really just some of the overview, some of the free features on our plans. So we have our $0 preventative dental. This incorporates your 2 cleanings, 2 x-rays, 2 exams. We have currently over 90, roughly 90, $0 tier 1 generics. We have $0 preventative vaccines. This also includes like your Shingrix 2-part series. $0 hearing exams, $0 preventative care services, and we also have a $0 flexible fitness package, which I'll talk about as we kind of move through the presentation. some of the allowances and savings opportunities for our members. That $1,000 comprehensive dental, our members really seem to love that. And I do have a slide that kind of goes in depth a little more about that dental piece. The 90-day prescription supply. So this is your two copays for a 3-month supply at most retail pharmacies. We do also have mail order, and that would be through Express Scripts or Wegmans. We use True Hearing as our hearing aid vendor. They have hearing aids that are the advanced, it's $4.99 per aid, or the
Can't hear anything.
premium, which is $7.99 per aid. One thing I just want to call out with True Hearing, we have in the past, when this was a little bit newer of a benefit, had people that just went out and bought hearing aids and then their claim was denied. With True Hearing, what a member wants to do if they're wanting to utilize their services, they want to contact True Hearing directly. And Rob, I can always send the information. I believe we have a contact sheet with multiple vendors and their contact, but they want to call True Hearing directly. And based on their zip code, True Hearing will provide them with different vendors that participate. So you want to make sure that you're going directly through True Hearing. So the dental, so Smile, we have you covered. So there's no deductible or copays or coinsurance for the preventative piece. We get a lot of questions where, with the preventative, does that take away from the $1,000 class 2 and 3? It does not. They're completely separate. There is the $1,000 annual benefit allowance that goes towards your
That
comprehensive
picture.
and your services. The preventative services, as I mentioned, they do not accumulate towards that $1,000 allowance. And this does include in and out of network benefits. So services are generally reimbursed at the in-network fee schedule. Any out-of-network providers, they
Jesus
may
Christ.
balance bill. So just be aware that if you're a member, they can, if they have a dentist that they've gone to for years and years and they're out of network and they don't really want to change, your members can certainly use that out-of-network dentist, but just be aware that it's likely that they're going to have to pay up front and then seek a reimbursement claim form from the plan, and then essentially we'll reimburse them up to the allowed fee schedule. If the provider's charging more, that's where they may end up having balanced billing. So again, just be aware of that. And then the preventative services, again, covered in full, no copay, no annual dollar maximum. It's limited to 2 oral exams, 2 cleanings, and 2 sets of bite wing x-rays, and this is per calendar year. There's a full mouth x-ray, and that is basically allowed once every 36 months. So as far as that comprehensive piece, the $1,000 dental, this just gives you a quick snapshot of some of the things that are applicable. And these would be things like your restorative services, fillings, periodontics, extractions or your oral surgery, things like your endodontics, your root canals, your prosthodontics, crowns, bridges, other oral surgeries. And the one thing that we get a lot of questions on, and we haven't made any headway. I'm hoping at some point it will be covered, but implants are not covered. So if your member has anything done that like corresponds or is coded as implant or something related to that, the claim will deny. So just be very aware of that. Implants are definitely not covered as of now. So I'm going to talk a little bit too about our over-the-counter allowance. So we utilize Convey. That is our third-party vendor. The quarterly allowance, depending on the plan, can be between $30 and $90 per quarter. These quarterly allowances, they do not roll over from quarter to quarter. So please, ingrain that in your mind as well as your members. They need to use as much of that allowance as possible per quarter. They can only make 1 order per quarter. We did notice when the benefit initially rolled out, somebody would go in, they might buy a bottle of aspirin and then try and go back in during that same quarter, and it wasn't allowing them to order anything additionally. So remember, the allowances do not roll over, they do refresh. But you also want to make sure you use as much of that benefit during that 1 order as possible. If for some reason the member wants, they have $12 remaining and something that they're looking to buy is 15, they can actually pay the balance. So they do give you the option to, pay that extra $3 if there's something additionally and you want to make sure you're making the most of that benefit. This isn't something like UHC where you have a card. Essentially, what happens is when somebody becomes a member, a catalog is automatically shipped out and it does have an order form. So the orders are placed via the catalog only. They cannot be made at retail stores. There are multiple ways to order. So if you have a member that's tech savvy, they can log in right online and basically order whatever they're needing. They can also use mail. Again, as I mentioned, there is that form that will be attached to the catalog. Or if you have somebody that maybe isn't as tech savvy, they can just call Convey directly and let them know what they're looking to order. We do have PDFs of the catalogs if anyone needs them. I can shoot those over to Rob. And I did actually recently request from our operations team a couple of the hard copies. I should have, I'm thinking about 50 of them. So I wouldn't be able to mail, 20 per person, but I can at least, if it's something you'd really like to just have and kind of peruse, I will have, hopefully in the next couple of weeks, some of the hard copy catalogs. As far as the mobile app, again, if you have somebody that's a little more tech savvy, they're comfortable using a mobile app, they can also order their OTC items through that. So Fit On. Fit On, we were previously with Silver and Fit, and I think a lot of the frustration that came from our members essentially was that they didn't really have a variety of gyms. They couldn't go to multiple facilities at once. So with the introduction of the Fit On, that's really what we were hoping to alleviate. Fit On, essentially, it's based on a credit system. So members have 36 credits per month. The credits do not roll over, but they do refresh month to month. The member does need to register. So they would, again, if they do have access to a computer, they register. Once they're registered, they can essentially type in either the location of the fitness facility they're looking to go to, the zip code. It will populate any facilities in that area. And then there's a place really where you can just press that you want to add that to your cart. You don't have to worry about, or the member does not have to worry about like doing this month over month. Once they're registered for a gym, they're in that location until they either cancel or change, fitness facilities. So again, just be aware the credits don't roll over month to month. People do have the opportunity, say you want to try out a yoga class or a spin class or some sort of, one-off class, you can use any additional credits left over to do that. So Wellve. Wellve is a tool that we introduced a few years ago. This is really an online decision support tool, which ultimately helps our members decide on, prepare for, and recover from surgery. The program really illustrates how a member can work with their doctors to A, confirm that they have the correct diagnosis, and B, explore their treatment options. This ultimately helps them prepare for and recover from surgery if that's actually the right choice for them. And I know a lot of our members get correspondence on Wellve. A lot of the times we have brokers and members ask, like, what is this? So, just so you're aware, it really is a decision support tool. Members that complete this educational program, they do receive a $25 gift card. I believe it's through Amazon. So members can use the Wellve tool as many times as they want, but just be aware they'll only get that gift card once. So again, certainly promote that. And if anyone has questions, we can get additional materials out. I know some of you use our sales hub. The sales hub is really, really just a wonderful, option for our brokers. It houses all of our marketing materials, even has things like, our summary of benefits and other pieces that you may use. There's customizable pieces if you want a pull-up banner, anything of that nature. It's all out there. You can, as of now, you can save it as a PDF and then just reach out to us if there's something that's customizable that you want ordered. There's everything from window clings to tabletop banners, smaller banners, and we're happy to help you order those items. I believe we will be actually, having more capability and functionality through that sales hub where members will be able to, or excuse me, brokers will be able to actually, order their kits, order marketing pieces, and have them directly shipped to them without us having to essentially intervene or, make that order for them. So, the ultimate goal is ease of use and to certainly prepare you with any items that you need. So the Flex card, I know some of you, you may sell out in the CNY region. So the Flex card, as of now, it's only available on the Medicare Blue Flex plan in CNY, as well as the Univera Access plan. We do get a lot of questions, how does my member use this? What do they get? Essentially, if a member enrolls in one of those two plans that offers the Flex card, they get it looks pretty much like a MasterCard with their name on it. It's ready to go once it's sent to them. And really, they just swipe it. So they would just swipe the card and they have up to $250 to use. People do, ask what is eligible? So you can use this towards in or out of network providers. This would be something that somebody in the CNY region or Univera, they could use towards authorized dental and vision, as well as hearing locations that accept MasterCard. Comprehensive dental. So if you have you exhaust your $1,000 and you have a $200 balance, you can swipe that card. Certainly use that. And it can actually be used for dental implants, although it will only put a small dent in the cost. They're very expensive. At least they still have that option to use that 250 towards that. Eyewear, it has to be prescription, so it would be towards glasses or contact lenses, as well as hearing aids, and that 250 can also go towards true hearing. So things that are not eligible, these would be like non-medically necessary, more cosmetic, teeth whitening, things like that. Non-prescription glasses. So unfortunately, you can't go buy a pair of Ray-Bans unless they're prescription. And then co-pays. We have had members try and use these for, use the card towards their co-pays, as well as the medical benefit side of things, and the card will deny. There's basically merchant ID codes. One thing we did notice is with like big box stores, we'll use Costco as an example. A lot of the times members have had to just pay up front, and there is a flex card reimbursement form that they can obtain from us to provide to their member. A lot of these big box stores, so to speak, they're not coded, as a dentist or an optician. So essentially, and some of them don't take MasterCard. So just be aware of that. But there is a solution. Again, if you have a member on one of the applicable plans, we do have a claim form that we can shoot over and ensure they can get reimbursed for those flex card dollars. So prescription payment plan, this was a really hot topic in, leading into 2025. The prescription payment plan, we do have information if anyone needs that, how it works. We have the prescription payment plan form. In the event anyone needs that, just reach out to us. But effective of January of this year, we introduced the prescription payment plan. All carriers did the same. And ultimately, this will help our members that are on high cost medications really smooth out those cost shares over the course of the year instead of kind of being walloped with one massive payment. If they do opt in, they pay nothing when they go to at the point of service. So if they go to Wegmans, they're not going to pay anything for that covered Part D drug. Ultimately, what happens is those out-of-pocket costs, those would essentially be billed to the carrier, and then we, in turn, will bill the member. I know that this is probably across the board for all carriers. Trying to implement this was a little bit of a bear. So I do know that the invoices for the payment plan have just started to go out to our members. There's no fees or penalties. They're not really concerned with the late payment because we know, this was a heavy lift on our end and a lot of other carriers. So at this point, your members should start to expect to see those invoices come in. And if they have questions or you have questions, please reach out to us. If they do not opt in, they do have to pay the pharmacy that, cost sharing amount that participants would have paid if they're not in the payment plan, and then, bill the program participants. We have seen a pretty big influx of people joining this prescription payment plan. But the thing to keep in mind is if you have somebody that's on a lot of tier ones, tier twos, this may not be an advantageous thing for them to really join. It's really meant for those people that are on really high cost medications. So troop was another question. We get questions all the time. We know that max out of pocket for the Part D was reduced to $2,000, which is wonderful for our members, but it was definitely a lot of work on the back end for all carriers. This was sent out in our newsletter, I believe in November, December. If anyone needs a copy of it, let me know, or Rob, I can send you any of the pieces that we talked about, so you can certainly disperse those to any of your team members. So ultimately in 2025, the following payments do contribute to Troop. This would be like your deductible, copay, coinsurance made by the member, family, or friends, payments made by Extra Help, uh, health plan sponsor, Blue Cross Blue Shield contributions, payments made by an employer or union, TRICARE, Indian Health Service, AIDS Drugs Assistance Program, payments made by charities, as well as most state pharmaceutical assistance programs. And then there's also, we get questions, well, what doesn't count towards the troop? So here's a list of things that would not be applicable. Those are your plan premiums. Any drugs that are not covered by the health plan where the member has to request prior authorization, those are not going to be covered. Non-Part D drugs, manufacturer discount programs, drugs covered by the Veterans Administration or workers' compensation, as well as drugs covered by employer group supplemental drug coverage. And again, if anybody wants a copy of this, please let me know or let Rob know, and I'll get that out to you. So pharmacy options, just to kind of give you a quick snapshot of what our pharmacy, what this entails. So retail pharmacy, we really include most of our major chains. As of now, we have over 60,000 pharmacies nationwide. The preferred network is 30,000. One way to determine, we get a lot of questions, is this preferred or standard? If you look in the directory, underneath the pharmacy section, if you see a bold letter P, that will denote that is a preferred pharmacy. So that's a really easy way to determine who's preferred and who's standard. There's generally about a $5 savings going from preferred versus a standard pharmacy. So we have 36,000 standard network pharmacies. And again, as I mentioned, that 2x copay for a 90-day supply, that's still available with most of our retail pharmacies. The only time we notice sometimes we can't do the 2x copay is usually when it's like a mom and pop kind of pharmacy, a smaller outfit. The mail order, as I mentioned, we incorporate two different options. It would be Wegmans as well as Express Scripts. There is a contact sheet, as I mentioned, which is wonderful to have. It gives you just about every number you need. I can always send that to Rob. And again, if you'd like a copy of it, just let us know. As far as the mail order, members can anticipate usually a turnaround time of about 5 to 8 business days. And even with the mail order, you can use that 2x copay for a 90-day supply. So diving into Rochester, this is just a quick snapshot. Most of you will likely be familiar with the plans and any of the changes, but just as a little bit of a refresher. We unfortunately did away with the access plan last year, which quite frankly was a complete bummer. Our members loved it. And we implemented the Blue Choice Discovery as a different PPO option. And this is, again, is really, really great for people that are snowbirds and tend to travel more. So the monthly premium on the Discovery plan is $34.30. And just a couple highlights about the plan. You have $5 primary care, $45 for your specialist visit, $5 lab copays. Again, that $0 preventative with a $1,000 class 2 and 3 allowance. $0 routine hearing, $150 annual eyewear allowance. One thing I just want to mention with the annual eyewear allowance, it is a reimbursement. We get a lot of questions about, well, what network do they have to use? They can use an in or out of network, eyewear provider as long as they're licensed. Either way, whether they're in or out, the member's going to have to pay up front and then fill out a claim form for reimbursement for their eyewear or contacts. And then with the Discovery, also that fit on flexible benefit. So I won't bore you to death by going line through line on the Rochester changes. But as you can see, we have the extra HMO, the select HMO. We do have a couple of the HMO POS, and that POS benefit, that it means point of service. Most of you probably know that, where if you have somebody that travels, but maybe they're not like a full snowbird, they might go to Florida once in a while. Be aware all plans have emergency and urgent care worldwide, but these POS plans, they give you a little additional flexibility where if you see a doctor out of network or a provider, you have $3,000 to use for those out of network services. Just be aware that the $3,000 point of service benefit, it doesn't count towards the maximum out of pocket. So I just want to call that out. Anything on this chart that's in green, it doesn't mean that we eroded the benefit. It really means we enhanced it. So things like PT, those were reduced to $35 on a few of our plans. Primary care, that was reduced on the select plan. Outpatient hospital, that was also reduced on the select plan. The OTC quarterly allowance, that was bumped up to 90 on our select plan. And then the eyewear, really, they enhanced quite a bit this year, up to 350. Same with the extra, they went from 125 to 250 on the annual eyewear, and all have an increase of $50 on the OTC. The advanced plan, again, that PTOT reduced to 35. So we did, it was definitely a pretty disruptive year, but we tried to stay the course and not impact our members too much. It'll be interesting to see what 2026 brings. Unfortunately, I don't have any information as they're in the midst of filing the bid. But to be very transparent, it sounds like it may be a repeat of last year. So please brace yourselves because it may sound like another disruptive year. CNY in East, for those of you that may sell in that region, they have essentially all PPOs, which is a wonderful thing. So they have their Flex PPO, the Flex PPO. So they also have the Active, the Essential, the Classic, and the Enhanced. The Flex is the PPO that actually has the Flex card on it. And again, not to bore you to death, but you can see in green, these are all things that essentially we reduce these specific co-pays for things like primary care, urgent care, and lab. As far as support, I always try and be as accessible as possible. When I'm traveling or in meetings, I can't always pick up my phone. So I want to ensure that you do have our contact information for our broker support. Liz Gardner handles the Rochester region. We actually just hired Nancy Sudor. She will be helping with the Western New York region. And then Renee Marchione also handles the Central New York region. We try to at least respond within 24 hours, even if we do not have an answer for you, just to know that the email was received. During AEP, please bear with us. I think this past year we were probably answering about 600 emails a week. So trying to manage that, get to other departments, get the information, it can be a lot. So, we definitely understand, there's times that you need the information immediately, and just put in the email, flag it as important if you need to. That way we know, to look at that first. I also wanted to provide you with the broker support phone numbers. I know a lot of people aren't necessarily sure who to call. We do have our customer care line. The unfortunate part about that is it depends on who you get. Some people may make you call in with the member. Other people may assist you, and it can be a headache, especially when you're managing a million different things. So we do have a broker support line for Central New York. That would be Renee. And the phone number is 855-841-2498. Rochester and Western New York, those phone lines are 844-611-5878, and that would be Liz and Nancy. We're generally open from 8 a.m. to 5 p.m. Monday through Friday. I do know that for AEP, we are considering, in basically increasing our hours where we're open later in the evening as well as possibly on Saturday. We just know with last year, I don't think we were anticipating the influx of membership that we took on. So it was definitely a juggling act. So we just want to make sure that we're staffed. I think we're going to be adding even more broker support people to our team. And we just want that ease of use to be there for you where you're not waiting days on end. And with that, I am done. So if anybody has questions, feel free, or if there's anything in the chat, let me know. If there's anything I can't answer now, I will certainly take it back and make sure I get you an answer.
Darcie, thank you so much. I really appreciate it. Very informative webinar. I apologize. I'm kind of bracing myself after you made that
It's
comment.
okay.
So looks like fun times ahead, and I'm excited to let everybody on the call understand some of the commitment that we provide for our advisors with regards to all your Medicare business, and wanted to be sure that you're aware of some of that value that we provide. Hold on a second. There we go. We're very committed to really investing in our advisors and want to make sure that you have the tools at your resources at your disposal to be able to be successful in this market because it's all about the ease of doing business. And when your business is when you have the tools that make it easier for you, you're more likely to find a lot of value with CAFL. And we're glad to let you know that we have access to some of the best lead platforms in the industry with LeadStar Marketplace, Medicare Express. Those are specifically geared towards Medicare Advantage, offering preset appointments, inbound calls, and direct transfers of Medicare beneficiaries who have a valid election period and are enrolled in Medicare A and B. So those are very valuable lead sources. We're looking to partner with advisors too, and helping with those, with those fees are associated with those as well. So also, a lot of the success that we're having with advisors is we're offering all of our advisors access to our premier online enrollment platforms, quoting and enrollment platforms. Sunfire allows you to quote all of the carriers in the region, Excellus, whatever the carrier may be, Excellus, Cigna, United Healthcare, all of the carriers. So you can provide your clients with an accurate quote. It really helps you, puts you in the light of that you're being transparent with your clients to showing them what's going to be most valuable to them as specifically. And then you can use that tool to enroll with the national carriers. Also regarding with enrollment, Excellus has a fantastic tool. Their Destination RX tool, connection-based platform is fantastic, very easy to use for enrolling your clients into Excellus's plans. I certainly recommend if you're not using one of those online enrollment platforms, we can certainly help you out with getting onboarded with that. And most excitingly, I'm excited to be sure that you're aware of our CAFL Cash marketing reimbursement program that, like I mentioned, we really want to make sure that we are investing in you, our advisors. We know that it can be very, there's a lot of costs involved in marketing and want to make sure that you know that we are doing everything we can to recognize that and making sure that it is something that that we want to invest in your business to help you be more successful. And so our marketing reimbursement program provides up to $1,000 annually. I'm just going to show you this flyer right now. So um, into our advisors. So a $3,000 maximum annual reimbursement program um, that just a second here. I'm going to show the screen. Just change the screen real quick here. Well, anyways, I apologize for that. Little technical difficulties in trying to share that flyer. But anyways, our Capital Cash marketing reimbursement program, again, can reimburse advisors up to $3,000 annually for eligible marketing expenses. We base it upon for every 12 enrollments that you issue between February 1st and December 1st of each year, you can request $500 in eligible marketing reimbursement and we were glad to reimburse either you, the advisor, or pay it directly to a uh, third party marketing representative, like a lead vendor or another marketing outlet that you're using. Um, and then if you have 36 enrollments during for AEP for 1/1 effective dates, 36 enrollments can be reimbursed for $1,000 in reimbursement, again up to a $3,000 annual max. We just ask that the receipts that you submit for those be within 3 months of the date that you request the reimbursement. Again, a lot of advisors are finding a lot of value in that particular program that we're offering. And if you do have expenses that you've submitted throughout this year and incurred throughout this year, feel free. And you've done 12 enrollments, uh, go to our website, capital.com/Medicare to access the reimbursement form that you can complete. Also, a lot of success and glad to be able to partner with our team at AmeriLife for outstanding compliance, uh, guidance, review, and approval. A lot of times advisors will have to, want a marketing piece and they want approval on the marketing piece from a compliance standpoint to make sure that it meets Medicare's compliance requirements. And I'm very excited to let you all know that when I have submitted those on behalf of advisors, I'm getting approval responses within 48 hours. So I previously in my career, that has taken several days, if several weeks, in fact, to get approval on compliant pieces. And I am consistently getting approval with approval codes within 48 hours for advisors who are submitting marketing pieces. So if you do have a marketing piece that you want to submit or you want to do something, start planning out your marketing plans for AEP, and you want to have marketing pieces approved, feel free to, email me a PDF of your piece. I'll give it I'll look it over first. If I find anything that I know that would be flagged for non-compliance, I'll work with you to make sure it is compliant, then submit it to our compliance team with AmeriLife. And if they have any additional requests or changes that need to be made, they're very prompt. And I'm usually, again, seeing responses within 48 hours after final submission. So a great service that we're able to provide to advisors. And of course, contracting with all major carriers. With regards to Excellus specifically, we are glad to partner with a new upline with regards to our national marketing partners through AmeriLife, and that transition has been going very, very well and smoothly. And glad to have further updates on that process in the next couple of days as well regarding additional trainings or agent service questions that many of you may be having. So I do see just some additional questions. I'm going to be sure to look those up. Just a second. Darcie, I appreciate you answering some of these questions that have been asked.
Yeah, no problem. I just was kind of answering them while you were chatting,
That's
just
great.
so people
Thank you
had,
very much.
yeah, no problem. I know when you're definitely hosting, it's kind of tough to juggle, multiple things. So
Yeah, and I
not a
have like three.
problem.
I'm looking at three different screens up here too. So I like, where's the one? Where's the button to share the screen? And where's this? And I couldn't find it. So I appreciate it. Thank you. Um, a couple of questions I'd like to ask that had come up um, regarding plans in which there's a Medicare Part B reimbursement. Can you talk about some of those, how that process works with regards to when those beneficiaries can expect to see their reimbursement from their Social Security?
Sure. So some of our Part B refund plans, when a member joins those, it can take 1 to 2 billing cycles. We send a file quarterly over to Social Security to distribute those funds. If a member is not collecting Social Security, essentially it's a credit towards their Part B premium. So that Part B premium is reduced. If they are collecting Social Security, whatever that Part B refund is, it's added back to their Social Security check. We have had a couple, maybe 2 or 3 instances where someone has not received their Part B refund. If you run into that, please reach out to us. We have been working with Social Security and CMS to diligently try and get that corrected. We automatically send the funds, but I think sometimes it kind of gets lost in translation, especially with the file only going back and forth once a quarter. So if you do have questions or somebody notifies you they haven't seen the refund, reach out to myself for those Excellus BSD boxes and we'll absolutely look into it for you.
Excellent. Thank you. And then if you could just the Medicare prescription drug payment plan, just can you reiterate that process again in terms of where the beneficiary initiates that plan
Sure.
that
So we actually, and I can send that over to you. We have a prescription payment plan form that members can fill out. It's really important. They want to do it as early in the calendar year as possible, because if they're doing it 3 months towards the end of the year, it may not be as effective as if they signed up in January. But on that form, it'll basically tell you where to mail the form back. We get those processed relatively quickly. So the member should be able to, like within the same month, go to their pharmacy and be able to just pick up their prescriptions at no cost.
excellent. If anybody has any further questions, you're feel free to type those into the chat feature. But again, just want to thank everybody for their partnership, for joining this webinar today, and for the business that you're writing from with Medicare with Excellus. And again, glad to be of any service. Please feel free to give us a call. You can contact me. My number is 585-440-2920, or you can reach out at Medicare at CAFL, KAFL.com. And again, everybody, thank you very much. Darcie, again, tremendous thanks to you and your team for the tremendous service and partnership that we have with Excellus. It's much appreciated and look forward to continuing working with all of you. Thank you so much.
Thank you, and thank you to everyone for joining today. I hope you took something away from this. We appreciate you so much. You are our bloodline, and if there was no you, there would be no us. So I cannot express enough like the gratitude we have for all of our broker partners.
Thank you again.
Thank you. I hope everybody has a good day.
I see maybe one more question here. Let me just see this. Okay.
Oh, I answered one of them.
Great. Thank you so much. I see
You're
that.
welcome.
So, uh, you all have a great rest of your day. Take care.
Bye, everyone. Thank you so much.